Are you managing diabetes and sometimes feel like your health picture is incomplete? Here's something important to consider. Diabetes can often be linked to other health issues you might not even suspect. Many individuals with diabetes also experience additional conditions. You're about to learn about 6 significant illnesses that have a strong connection to diabetes, knowledge that could be vital for your overall health management. 1. Autoimmune thyroid diseases. Given that type 1 diabetes itself is an autoimmune condition where the body's immune system mistakenly attacks the insulin-producing beta cells in the pancreas, it's not entirely surprising that other autoimmune disorders are more prevalent in this population. Among these, autoimmune thyroid diseases stand out as particularly common. Consider Hashimoto's thyroiditis, a condition where the immune system attacks the thyroid gland, often leading to an underactive thyroid, also known as hypothyroidism. Symptoms can include fatigue, weight gain, and feeling cold. On the other end of the spectrum is Graves' disease, another autoimmune disorder targeting the thyroid, but this time resulting in an overactive thyroid or hyperthyroidism. This can manifest as rapid heartbeat, weight loss, and anxiety. Studies indicate that individuals with type 1 diabetes have a significantly higher chance of developing either Hashimoto's or Graves' disease compared to the general population. For instance, some research suggests that up to 25% of people with type 1 diabetes may also have an autoimmune thyroid condition. Regular screening of thyroid function is therefore often recommended for individuals with type 1 diabetes to catch these issues early and manage them effectively. 2. Addison's disease, primary adrenal insufficiency. Addison's disease, also known as primary adrenal insufficiency. This occurs when the adrenal glands, located above the kidneys, don't produce enough of the essential hormones cortisol and aldosterone. Cortisol plays a vital role in regulating stress response, blood sugar, and inflammation, while aldosterone helps control blood pressure and electrolyte balance. The co-occurrence of Addison's disease and type 1 diabetes, while less common than thyroid issues, is still observed more frequently than in the general population. Symptoms of Addison's disease can be vague and develop slowly, including fatigue, muscle weakness, weight loss, low blood pressure, and darkening of the skin. It's estimated that around 1 to 2% of individuals with type 1 diabetes may also develop Addison's disease. Recognizing the potential for this overlap is crucial, as an adrenal crisis, a severe form of adrenal insufficiency, can be life-threatening and requires immediate medical attention. 3. Vitiligo and pernicious anemia. 2 other autoimmune conditions that appear more often in individuals with type 1 diabetes are vitiligo and pernicious anemia. Vitiligo is a condition characterized by the loss of skin pigment, resulting in white patches on various parts of the body. This occurs when the immune system attacks and destroys melanocytes, the cells responsible for producing melanin, the pigment that gives skin its color. While primarily a cosmetic concern, its association with other autoimmune diseases like type 1 diabetes highlights a potential underlying immune system dysregulation. Pernicious anemia, on the other hand, is a condition where the body can't make enough healthy red blood cells because it can't absorb enough vitamin B12 from food. This is often due to the autoimmune destruction of parietal cells in the stomach lining, which produce intrinsic factor, a protein needed for vitamin B12 absorption. Studies suggest that the prevalence of both vitiligo and pernicious anemia is higher in people with type 1 diabetes compared to those without the condition. For pernicious anemia, this can lead to fatigue, weakness, and neurological symptoms if left untreated. 4. rheumatoid arthritis, and systemic lupus erythematosus, SLE. While the association might not be as strong as with the previously mentioned autoimmune conditions, rheumatoid arthritis and systemic lupus erythematosus, SLE, are also observed more frequently in individuals with type 1 diabetes compared to the general population. Rheumatoid arthritis is a chronic inflammatory disorder that primarily affects the joints, causing pain, swelling, stiffness, and potentially leading to joint damage over time. SLE is another chronic autoimmune disease that can affect various parts of the body, including the skin, joints, kidneys, brain, and other organs. The exact reasons for this increased prevalence are still being investigated, but it likely involves shared genetic predispositions and immune system abnormalities. Research indicates that individuals with type 1 diabetes have a slightly elevated risk of developing these systemic autoimmune conditions. It's important for both patients and healthcare providers to be aware of this potential overlap to ensure timely diagnosis and management of these conditions if they arise. 5. Non-alcoholic fatty liver disease, NAFLD. Moving beyond autoimmune disorders, non-alcoholic fatty liver disease, NAFLD, is a very common condition, particularly in individuals with type 2 diabetes and obesity. NAFLD is characterized by the buildup of excess fat in the liver in people who drink little to no alcohol. It's strongly linked to insulin resistance, a hallmark of type 2 diabetes, where the body's cells don't respond effectively to insulin. Over time, NAFLD can progress to more severe liver conditions, including non-alcoholic steatohepatitis, NASH, fibrosis, cirrhosis, and even liver cancer. Studies estimate that around 50 to 75% of adults with type 2 diabetes also have NAFLD. While traditionally associated more with type 2 diabetes, NAFLD can also occur in individuals with type 1 diabetes, especially those with poor blood sugar control or other metabolic risk factors. Regular monitoring of liver function may be warranted in individuals with diabetes, particularly those who are overweight or have other risk factors for NAFLD. 6. Sleep apnea. Obstructive sleep apnea, a condition where breathing repeatedly stops and starts during sleep, is another health issue that is more prevalent in people with type 2 diabetes. This is often linked to factors such as obesity and insulin resistance, which are common in type 2 diabetes. The repeated pauses in breathing can lead to lower oxygen levels in the blood, fragmented sleep, and increased risk of cardiovascular problems. Research suggests that up to 50% of individuals with type 2 diabetes may also have sleep apnea. While the direct link might be less pronounced in type 1 diabetes, some studies have also indicated a higher prevalence compared to the general population, possibly due to shared metabolic disturbances or other factors. Untreated sleep apnea can worsen insulin resistance and make blood sugar control more challenging in both types of diabetes. Therefore, recognizing and addressing sleep apnea is an important aspect of comprehensive diabetes management. Understanding these interconnected health conditions can empower you to have more informed conversations with your healthcare team and advocate for comprehensive care that addresses all aspects of your well-being. You might also want to watch this video on diabetes complications. Please subscribe to this channel if you found this video helpful. Thank you for watching.